So polymyalgia rheumatica is a really little understood and little researched condition which causes quite severe pain and stiffness, particularly around the shoulders and often the hips as well, and patients can find it variably troublesome, but some people are really disabled by it and can't get out of bed very easily, can't get into the car or out of the car, can't turn over in bed, can't push the covers back off their beds. Some patients have it a bit more mildly and are affected less badly by it. But diagnosis is really difficult for polymyalgia because we don't have any diagnostic test which really can clinch the diagnosis. The tests that we have, the blood tests that we have, are very non-specific and can the inflammatory markers we find on the blood tests can be elevated in all sorts of other conditions as well. So it's really important to get the diagnosis right, and for the patient who's got these symptoms, it's really important to get the diagnosis early so that they can get sorted out and get treated.
I suppose it all started last October. Prior to then I was perfectly alright, and then within about 2-3 weeks I was having great difficulty walking, pains, legs, shoulders, arms, and I went to the doctor. He prescribed anti-inflammatories which worked, but wouldn't prescribe a long course of them because of the side effects. So over Christmas I was crippled really, and then since then I went back onto another dose of anti-inflammatories which did the trick again, and then when they ran out I started taking cocodamol, which had unpleasant side effects, and I just started taking paracetamol. But I think on the whole I'm just getting better without any treatment at all.
The first study visit is quite long, so what happens is patients come up and we go through the whole consent form and make sure that they are okay to sign it, answer any questions, and then they sign the consent form. And then after that I take a medical history and I examine the patient. We take some blood tests, firstly anything that they need for their care, and then plus some research tests on top of that. We do what I call weighing and measuring, which is just some basic height and weight type things, blood pressure test, a special kind of modified blood pressure test called pulse wave velocity test, and then they also have one X-ray of their back, and they go down then and have a research ultrasound with our sonographer down in the LMBRU, which is our research unit, and then if they are prescribed the treatment, they then collect the treatment from pharmacy, and that's the end of the visit. And then subsequent visits, it's almost the same, only without the ultrasound, and also clearly discussing response to any treatment and further treatment plans.
I was eventually, after trying physiotherapy, which was the doctor's first effort at trying to fix me, he referred me to the hospital here, and the doctor I saw here asked whether I want to take part, and I'm more than happy to do so. And my feeling is, I knew nothing about this before. I know how unpleasant it is, and if I can do the slightest thing to help other people, I'm more than willing to do it.
Mm-hmm. So what we hope to achieve by this study is we hope that we can develop better diagnostic tests of polymyalgia so that GPs, hopefully the sort of test that GPs could request directly without having the patient having to wait to see a hospital doctor, without having to go through lots of uncertainty and, oh, what have I got, and to be able to give a rapid, accurate diagnosis, avoid overdiagnosis, so to make sure the test is very specific, so that GPs can give even better care to their patients who they suspect have polymyalgia, and patients can have even better outcomes in terms of their health and their quality of life.